Good afternoon, I'm Alan Unell, and this series of videos is called Healthcare Reform Advocacy. We address problems in the healthcare system and have solutions that we can all take to make the system work better for all of us. This is the end of September in 2023, and I know we're running towards the government shutdown cliff, and that's eating up all the oxygen to discuss anything else, but there is something else. I've got my eyes open and I know that we have a little ways to go to get enough universal health care votes this week. That means we probably won't make it. But in the meantime, I want to point out that there are 30 million of us who live in medical deserts. Now that's a place where there's about one doctor for 10,000 or more people. That also includes a lot of the rural communities in the United States, and help is really needed. Earlier this week, I wrote a bill that was brought to the Senate by Senator Sanders of Vermont and Senator Marshall, who happens to be a Republican from Kansas. And it was to build more facilities in rural areas, medical facilities, provide more services like vision, dental, and mental health care. They want to get 60,000 nurses trained and another 2,000 doctors. And in the description section below, I'll have a link to a healthcare advocacy write-up that describes the bill in detail, together with an action you can take to encourage your congressperson, your senator, to vote for it when it comes up for a vote. Anyway, let me give you some details about what the bill does. It provides $5.8 billion a year for each of the next 3 years in mandatory funding for community health centers, and they provide high-quality primary health care to about 30 million Americans. It increases the hours of operations in those facilities. That costs another few hundred million. It provides about $3 billion in capital funding to enable community health centers to include dental and mental health care. It works also with the Service Corps, the National Health Service Corps. You may not be familiar with them. They currently get about $300 million a year to buy down doctors and healthcare professionals' tuition debt when they practice medicine in medical deserts. They want to triple that to $950 million a year and provide 2,100 scholarships, medical scholarships, for some 20,000 doctors to make sure that they get to work in the places where they're needed most. I should point out, it's not just doctors. They will provide scholarships also to nurses, dentists, mental health care providers. There's an awful lot it'll do, and we need to support it. There's just no way out of it. If we're not going to have universal health care this week, then let's support this bill. The bill is Senate Bill 2840, and there is an action in the comment field below that, using ResistBot, will send an email to your senators giving them a sample of what's in the bill and asking them for their support. So I'd like to do that. This is a healthcare Band-Aid. It's not a cure, but a Band-Aid. The other thing I want to talk about today is healthcare denials in the insurance system, health claims denials. Previously, we've reported that it is difficult to get state-level data on the rate of denial that each insurance company has in each state. The federal government is supposed to capture this information for ACA plans and Medicare and for employer-sponsored plans. They only get data from 30-some states because some states are recalcitrant and won't provide data, and they don't collect the employer data. So, and this is an old law. This is from 2010. We've written letters to them to ask them to do it, but in the meantime, we've discovered that many states don't provide that information to make consumers more aware in each state. Now, I've called my state's attorney general and insurance commissioner and asked them for it, and they said, we don't have it. I called California and I asked, do you have it? And they said no. I called Utah because one of the readers of our newsletter, Healthcare Advocacy, said, check them. And amazingly enough, they've got the data and they publish it. So consumers in Utah at least know what the denial rates are. Now, I didn't mention why it's so important. It's because some insurance companies have a claims denial level of about 3%, and some have a claims denial rate of up to 49%. And if you're going to buy an insurance policy, you know, that 49% doesn't sound too good. Anyway, again, in the description field, what I've done is I've put in a link to a website where you can find your state's Consumer Protection Bureau. And you can just send them a note like I did to say, I want to know what the insurance claim denial rate is for healthcare in my state. And I'd like to know the approximate value of each claim that's denied. And I have a link for the data that Utah provides, so you can send them that as an example. So that's an extra credit action. I hope this is useful to you. Like, share, subscribe. All the information and links will be in the description below. Thank you.